Welcome to the telehealth foot and ankle exam, ensuring the patient has at least 6 feet in front and behind before beginning the encounter. We're going to start off with inspection, which includes any skin changes, including erythema, ecchymosis, scars, or abrasions. Next, we're going to look for any ankle edema, medial aspect of the ankle, the lateral aspect, having the patient face the back of the room, assessing for any edema of the Achilles, or retrocalcaneal space. Next, we can assess for arch. Here, have the patient stagger, and here we're going to look for any normal arch, pes planus, or pes cavus. Here we can also assess for any deformities, including Haglund, bunion, hammer toe, callus, corn, and having the patient face the back of the room, we can also assess for calcaneal varus and calcaneal valgus. Next, starting at the back of the room, we can assess for gait. Here we can assess for a normal gait, foot drop, or Trendelenburg, where the hip seems to drop with every step. Here we can also assess for toe walking, which includes their ability, inability, or ability with difficulty. We can also assess for heel walking at this time as well. Next, having the patient come back and facing the camera in a seated position, we can assess for range of motion. First, we'll start off with dorsiflexion, making sure we're always comparing it to the other side. Next is plantar flexion, inversion, eversion, flexion of toes, and extension of toes. Here we can also assess for any special maneuvers, first which including pain with self-palpation, anterior tibio-talar joint, lateral malleolus, medial malleolus, fifth metatarsal, navicular, calcaneus, or Achilles tendon. Starting off the special maneuvers, we can also attest for windlass test. So having the patient raise up their foot and flexing the big toe back, testing for any pain, which would be indication of plantar fasciitis, heel squeeze, metatarsal squeeze, and Tinel sign, which are tapping the back of the foot. A positive test would be any paresthesias or tingling. Next, have the patient stand, and using the chair as a guide if needed, we're going to test for a single leg balance test. Here we're testing for any ankle instability. And switching to the other side. Here in pediatric populations, or people who feel comfortable, we can also hop on one foot, switching to their side if time permits, and hopping on 2 feet. And last test would be the lunge test. So having them face the camera and taking one big step towards the camera, assessing for any ankle instability, and switching to the other side. And this concludes the telehealth foot and ankle exam.